And loneliness, the reason it's a really important topic for us to discuss today is because there are health consequences associated with loneliness. Loneliness increases the risk for anxiety, depression, even mortality in individuals who have prolonged loneliness and they are not coming out of that because stress hormones from loneliness can impact our immune system, our overall mental and our physical health. So it becomes a stressor, even though it's an internal phenomenon. It's not something you can see, it's not tangible, but it's something that can definitely impact your mental and physical health. So, why does it happen in cancer? Why does it happen? Cancer creates a disconnect, right? People don't know what to say, they don't know how to say it, when to say it. Your roles shift. I talk about this a lot. Identity dissonance, where you identify as the strong go to person or the spouse who's the breadwinner, but that role shift and that identity shift can definitely cause isolation. So a spouse can become a caregiver, a friend can become a helper and not a peer. So those role shifts and those identity shifts can be one of the ways that you experience the loneliness. Isolation from daily routines, work and hobbies. So you're just not doing the things you used to do anymore. And I want you to really think about what it is and not the why. So you may be isolating from things. So it's just being aware of what you're isolating yourself from and not really thinking about the why right now, because that can be really overwhelming. But what are you isolating yourself from? What did you do before your cancer diagnosis or before you became a caregiver that you're not doing now? Just taking notice of those things without any judgment. And then cultural factors. This is another reason why loneliness can happen in cancer, because in some cultures, you have to be strong. You don't want to burden others. You want to kind of handle it all on your own. And a cancer diagnosis is really hard to handle on your own. And it's okay to ask for help, but we have to respect cultural norms and cultural factors where people feel like they have to be strong. They don't want to burden others. They're going to kind of do it on their own. They're going to use their faith. So it's one, understanding those cultural factors and respecting them.